Good afternoon, everyone. Welcome to today's webinar hosted by the American Academy of Pediatrics and healthychildren.org. Today we're discussing botanicals or herbal products as natural approaches to care for yourself and your children, and what parents should know when considering these options. But before we begin, a few housekeeping items. The webinar is being recorded, so if you lose connectivity for any reason, you will be able to watch and listen to the archived webinar, which we'll post to our website in about a week or so. If we can help you with any technical issues during the webinar, please use the chat function to send us a message. We will have time at the end of the webinar for a question and answer session. To ask a question, please use the chat function. You can activate chat by clicking on the speech bubble at the bottom center of your screen or the person-shaped icon for mobile users. You can send in your questions at any time and we'll get to as many as we can at the end of the presentation. Without further ado, we'd like to introduce our host, Dr. Jennifer Shu. Dr. Shu is a practicing pediatrician, author, and mom in Atlanta. She is the co-author of Heading Home with Your Newborn and Food Fights, a frequent guest on national and local television, radio, and web-based programs. She's also served as the Living Well health expert for CNN.com, has contributed medical information to Baby Center and WebMD, and serves on the Parents Magazine Advisory Board. And finally, she is the medical editor of healthychildren.org, the official parenting website of the AAP. Welcome, Dr. Shu.
Thank you. Thanks for that introduction, and thank you everyone for joining us today. We are more than 2 years into this new normal of the COVID pandemic, and we're also seeing a lot of parents looking for some more information about natural approaches to help support health and wellness for themselves and their children. So today we're joined by Dr. Melanie Brown. Dr. Brown is Medical Director of Pediatric, Palliative, and Integrative Care at Johns Hopkins in Baltimore, and a professor at the Johns Hopkins School of Medicine. She served as a program director for integrative medicine at Children's Minnesota and is the current chair of the American Academy of Pediatrics section on integrative medicine. She lives in Maryland with her husband and 2 daughters. Welcome, Dr. Brown.
Thank you so much. I'm very happy to be here with everyone today.
So as you know, most children in North America receive conventional types of medicine when they're sick. But many parents also want to know about natural approaches, which is why we're here today. Sometimes they're described as alternative, complementary, and integrative medicine. We also hear words like naturals, herbals, botanicals. So why don't we talk about some of these terms that parents should know? So what do these terms mean?
Well, this is a really important topic. It's one in which parents have lots of questions, especially since the start of the pandemic, as you noted. So there are some general terms that you should know, and you see them here. The National Center for Complementary and Integrative Health, or the NCCIH of the National Institutes of Health, really defines complementary therapies as evidence-based healthcare approaches that were developed outside of conventional Western medicine and that are used in conjunction with or in addition to conventional care. So let's start talking a little bit about conventional medicine. So as noted, conventional medicine is really a part of Western medicine. So another way to think about this is you can think about it as a mainstream medicine that describes treatments or therapies that are used by a medical doctor, osteopathic physician, nurse practitioner, or perhaps a physician assistant. Other healthcare professionals may include people such as physical therapists, psychologists, or registered nurses. Now, there are a number of examples of conventional treatment, and those can include things like antibiotics for infection, or let's say an inhaler for asthma. So the question then is, what's the difference? Well, you may hear the term alternative medicine, and if you do any looking on the internet or into the literature, you'll see this term used. But this term really isn't used as much anymore. It was sometimes used to describe a therapy or a treatment that's used instead of or in place of conventional medicine. Now, complementary, that's a term that describes something that complements the conventional medicine or other healthcare that's happening. So examples of this include things like acupuncture or massage or aromatherapy. Integrative is really an approach to patient care that uses the best of evidence-based, safe, and effective conventional and complementary therapies in a really coordinated way. Integrative clinicians promote health and they focus on prevention and health and wellness, and they encourage patients and families to be a part of the healing process. So when we think about integrative medicine, we're thinking about some of those areas that I mentioned above. So things like botanicals and herbs, aromatherapy, mind-body medicine, acupuncture. So in thinking specifically about botanicals and herbs, what is this? So we know that plants have been used for centuries for their medicinal or for their therapeutic properties, for their flavor or for their scent. So herbs medicinally may be used, the parts that you may use may include the leaves or the flowers and or the stems of the plant may be used. So some examples might be basil or chamomile, cilantro, mint, thyme, oregano, lavender, rosemary. So some of these things that may be used medicinally, but may also be used in cooking because they're delicious. Spices. So when we think about spices, typically spices are using the seeds or the barks or the root. So for example, that might be cinnamon or clove, ginger, which we'll talk a little bit more about, nutmeg, coriander, pepper, or turmeric. Honey, I lump this in there because honey is derived from a plant, right? It's derived from a flower, from the pollen, even though we do get honey from bees. So we talk a little bit about organic and you hear the words natural. So I think this is a really good time to talk about the differences between organic and natural. Organic really has a standard definition. So produce can be called organic if it's certified to have grown on soil that has no prohibited substances like synthetic fertilizers or pesticides. And those substances cannot have been applied for 3 years prior to harvest. So this is really important when we think about children and the burden that some of these chemicals can have on their bodies. It's important to note that natural is not a regulated designation like organic is. So natural is, it typically denotes that the foods are free of synthetic or artificial ingredients or additives, but it's not guaranteed. So there's no one regulating that. Aromatherapy, I mentioned, it's this intentional use of aromatic essential oils. They can be extracted from plants like flowers or herbs or trees. We use aromatherapy and essential oils in many ways. Sometimes they're used in baths, in a diluted form. They can also be used in massage oils or lotions applied to the skin. In pediatrics, we often recommend that aromatherapy be given by inhalation to promote wellness. We don't recommend the ingestion of essential oils with few exceptions, except for culinary use. So one exception is enterically coated peppermint that is often used for GI discomfort.
Let's talk more about that term naturals. Does natural automatically mean that something is safe or better for you?
No, it doesn't. So natural doesn't always mean safe. A lot of our conventional medications originally came from something natural that was modified or distilled. But think for a moment about something like poison ivy. So poison ivy is natural, but contact with the skin may cause irritation. Some natural ingredients may also trigger drug reactions or allergies. It's really important to consider the potency and purity of any herbal extracts and whether or not they've been studied and in what amounts and whether they're known to be safe in children. Now, side effects from natural approaches really are rare, but they can occur. So you always want to check with your child's doctor before adding or changing a therapy. When you talk to your child's doctor, talk about what you've heard and what you've read about natural approaches or products. Even bring the products you plan to give your child to your next medical appointment and bring that along with all of the other prescribed medications so they can really take a look at everything that the child would be taking altogether.
So you mentioned using some of these natural options for children and babies. Are they safe for this age group?
Well, there are a number of natural options that are absolutely safe for children. And when I think about these for children, or really for anyone, I think about safety versus efficacy. So, do we know for sure that they're safe? And when I say efficacy, do we know for sure that they work? So, more research is needed for all kinds of naturals for children. And this includes herbal ingredients. We need to understand more about what may help or work. And we also know that what may help or work for one child may not help for another. So, when talking to your pediatrician or your healthcare provider, really consider any potential risks versus benefit based on studies and available information before you decide to use a botanical or herbal. Ideally, you want to look for ingredients that are supported by clinical studies. And more importantly, though, you want to look for ingredients that have a well-established safe use over many years. Again, we do need additional research on some of these strategies for children. Some of the things that you may find or believe to be helpful may not have a lot of research to back that part of it. But the most important thing I would say is that, do we know that this is something that's safe for your child that you're using?
So what kind of conditions or illnesses are we talking about when we're looking for natural approaches? Headaches, coughs, sore throats, is that what you mean?
Absolutely. Yes, yes, all of these. For example, cough, let's think about that. Honey. So we know that cough medicines are not recommended for young children under the age of 6. So then that begs the question of, what can help? So one good option for children over the age of 1 year is a teaspoon or so of honey. This honey can coat and soothe the throat. There are studies that show that 6 kids who get a spoonful of honey before bed had better sleep and less coughing. Now, I do want to reiterate that honey should not be given to babies under a year of age because it can cause something called infant botulism. So if your baby is under a year of age and has a cough or other cold symptoms, it's best to check in with your pediatrician to see if your child needs to be seen in the office. There are other things that can help as well. So for cough and nasal irritation that's associated with hoarseness and dry throats and irritants, ingredients such as elderberry or English ivy and marshmallow root may help. We know that they are safe in children. Ingredients are harvested, and the plant part that we're interested in, like so maybe it's the berry or the root or the leaf, is extracted to really target the proportions that we know are important to deliver benefit. These extracts may then be formulated to match the quantities that have been tested in clinical studies.
What about, let's see, nausea?
Yeah, so ginger. So ginger is an excellent option for nausea, for sick stomach. I mean, you probably heard about using ginger ale to help with vomiting. Well, we now know through studies that ginger can be effective for treating vomiting in pregnant women. And there was a recent study that showed that it could help reduce the duration and severity of vomiting in children. Now, ginger may settle an upset stomach to help with nausea and vomiting through its antispasmodic properties. Um, you can use ginger tea, or you can make one at home very easily. Now, because I'm recommending putting honey in this, I'm gonna say this is for children older than 1 year, but a simple recipe is to add a teaspoon of freshly shredded ginger to 4 ounces of boiling water and let it steep for 5 minutes. Then you can serve it to your child warm or iced, and you can sweeten it with a little bit of honey. And I just want to draw your attention to an article that was just a link that was just put in the chat. And so please take a look at this. It talks about some things that can be used.
Let's talk a little bit about sleep and how natural approaches might be used there.
Yeah, so melatonin. So melatonin is something that I get a lot of questions about in my practice about whether it's okay to use for children. So melatonin is a natural hormone-like substance. It's produced by an area of the brain called the pineal gland. And it's released naturally at night. And it sort of is that, that signal that tells your body it's time to sleep. It's sold as a sleep aid, and it can be found over the counter as a dietary supplement in this country, which means that you can buy it at the pharmacy or the grocery store or the health food store without a prescription. Melatonin can be used as a short-term way to help some kids get rest while you're working on establishing good bedtime routines. It may also help older children and teens reset their sleep schedules, such as after vacations or summer breaks or other interruptions. Melatonin comes in a lot of different forms. It comes in a liquid or gummies. There are chewables and capsules and caplets. And there are lots of varying dosages that you'll see out there. There's no specific guideline from the FDA on melatonin dosing for children, so it really can be confusing. But here's what you can try. You want to start first with the lowest dose. Many children will respond to low dose melatonin, so like 0.25 or 0.5 or 1 milligram, when taken 30 minutes before bedtime. You're going to watch for any side effects such as morning sleepiness, drowsiness, or increased urination at night. I also recommend, dimming the lights and being really ready for bed after getting that dose of melatonin 30 minutes before sleep. While some studies have shown that short-term use is relatively safe, there's less known about longer-term uses of melatonin. So this is why we suggest using melatonin just for short amounts of time or under the direction of your child's pediatrician.
What if a child is taking some conventional medicines or using other natural products? Can there be some kind of interaction or any risks of doing that?
That is one of the really important things to consider. So a lot of times people will think that all natural remedies are safe, but your pediatrician is really the best person to help you decide whether there is a risk of interactions with your child's other medications and if there are any potential side effects when medicines or therapies are given at the same time. And one example that I'd like to give you for this is, there are some medicines that shouldn't be taken together. So you may be told to separate the time between magnesium from another medication, or to not eat a lot of grapefruit with certain medications because they might interact. So open communication is really the best way to promote the safest care possible.
So let's talk a little bit about vitamins, dietary supplements, and natural therapies. Are these all the same? And if not, how do they differ?
Well, they're not necessarily all the same. And that's why talking with your child's pediatrician about all products and treatments that your child's using is so important. So this does include vitamins and herbs and dietary supplements or any over-the-counter products. So it's always a good idea, as I mentioned, to bring the actual product so that your healthcare provider knows about all of what you're doing. And this is even important to note, like when you get a supplement from another provider. So maybe you're seeing a different type of physician or a different type of provider who's not a physician, and they give you a supplement. While that supplement might be safe, it's really important that you are talking to sort of your primary care person about everything that you're doing.
So I think you mentioned this a little bit earlier at the beginning, but are natural products regulated in this country?
Well, so the FDA considers natural products to be dietary supplements, and so they're not regulated as medications. The only, I would say, one that is sort of an exception to that would be homeopathic. But the FDA does not guarantee the purity, the potency, the effectiveness, or safety of natural products sold as dietary supplements. So while most people can avoid buying rotten tomatoes or bruised fruit because you can see that it's bad, it's much harder to avoid poor quality supplements. Because of this, it's a really good idea to look for reputable, trusted brands, ones that manufacture safe, high quality products under strict GMPs. And GMPs is also something called good manufacturing processes.
So while we're looking into some of these products, all of these things have labels on them. What should we be looking for? How can we read these labels and make sense of them?
Well, when reading the labels, it's really important to look at each ingredient and not just the primary ingredient that's highlighted. So how many milligrams of each ingredient is in it? How much filler is included? So you may have seen or read this statement on a package or in an ad. It says this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Well, this statement or disclaimer is required by law. That law is the DSHEA, in case you wanted to look for that, when a manufacturer makes a claim on a dietary label. So in general, you want to start with the lowest dosage. You want to look for any side effects. You want to try to use it only for short amounts of time, though for some vitamins, it's going to be necessary to use them for months to see the full benefit. And your pediatrician can be really helpful in helping you figure out the optimal amount of time to take it. You want to read the labels carefully to see if it's age appropriate. And again, to look at the dosing that they recommend for the age and the weight on the label for that specific supplement. Also, what is the expiration date or the shelf life? So often products without preservatives expire a little bit more quickly, sometimes even within 90 days once opened. And what are the storage conditions that are recommended? So, is it safe to keep on the shelf? Should it be refrigerated? Should it be kept in the freezer? And then use as directed. So you want to use the suggested amount unless your pediatrician or healthcare provider recommends a different amount. And notice how often and time of day. So for example, if you take caffeine in the afternoon or in the evenings, that might impact your sleep. And you also want to pay really good attention to any caution statements. You want to keep medications or supplements properly stored and out of reach of children. Generally, child-resistant packaging is not required, although there are a few exceptions.
You've been talking a lot about having parents talk to their pediatricians, let them know what natural products their child is taking, etc. So if many pediatricians are used to recommending conventional medicine, would they be able to also recommend some natural products if a parent were to inquire about them?
Well, talking with your child's doctor really helps you know if a treatment is safe and if it's effective. And so you would talk about all therapies given to your child, including vitamins, herbs, and other supplements. This is especially important because there can be dangerous side effects when medicines or therapies are given at the same time. You want to include information about other health professionals caring for your child so that that care can be coordinated, as we alluded to earlier. And, feel empowered to ask all of your child's healthcare professionals to talk to each other, because open communication is really the best way to promote the safest care possible. So you're going to be talking to your child's pediatrician or healthcare provider about all products being used, right? So including any sort of home treatments that they're getting, any over-the-counter medications, dietary supplements. And your doctor really may be able to help you better understand these therapies, the ingredients and the approaches, which I think is really a part of your question. And they can help you find out whether they have scientific merit, whether the claims about them are accurate or if they've been exaggerated, and whether they pose any risk to your child's well-being. Because keep in mind, as we discussed, that natural treatment does not always mean a safe treatment. So your pediatrician can help you determine whether there's a risk of interactions with the other medications. So the American Academy of Pediatrics has actually encouraged pediatricians to evaluate the scientific merit of national therapies and approaches, to determine whether they may cause any direct or indirect harm, and to advise parents on the full range of treatment options. So If you decide to use a natural approach to therapy, your treatment can also assist you in evaluating your child's response to that treatment. And remember again to tell your child's physician if that child has been seen by any other health professionals. Your child's health and well-being depend on open communication, trust, and respect amongst everyone who's on the team, so amongst all health professionals.
You mentioned wanting to make sure that any type of natural product would be safe and also effective. Are there any red flags or things that parents should be aware of that could be dangerous or harmful when using natural products?
Well, there are, and that's the reason we always say to talk to your healthcare providers. One example is intranasal zinc. So it was actually found that putting zinc in the nose can cause permanent damage to your child's sense of smell. So talking with your pediatrician about not only the products that you're thinking of using, but also the way they're being delivered and how you're thinking of using it can be really important. And I want to highlight that as we said, the FDA is looking at natural products as supplements. And so it is important to know, what types of manufacturing processes are being used for the different things that you're considering. So for example, with the melatonin supplements that we talked about, looking and seeing, what else is on there. Have they done any testing to make sure that what they say is in the container is in the container, and what are the good manufacturing processes that are being used?
Some parents ask if natural products have a role in the prevention of illnesses and diseases, and whether they might be able to use natural products instead of vaccines, for example. What are your thoughts on that?
Well, dietary supplements are not a replacement for the things that are the basis for a child's healthy growth and development. So they are not a replacement for good nutrition, for regular exercise, for proper sleep habits. We do know, though, that more and more pediatricians are offering complementary approaches and advice as a part of the medical practice. And so, although pediatricians do recommend conventional therapies such as vaccines to protect children from illness, many children are also recommending and referring patients to complementary therapies such as herbs, dietary supplements, special diets, and exercise. So while complementary therapies are meant to complement conventional medicine, it's not a replacement for the things I mentioned, like good nutrition, exercise, proper sleep, and also not to be used in place of vaccines.
What about using them compared to prescribed medications or pharmaceutical products?
Well, with your pediatrician involved in the process of deciding whether to consider using these things and what may be used in addition to conventional care for your child, I would say that in general, they should not take the place of prescribed medications. It's really your pediatrician who can help you make the determination. So one example is, as we talked about honey, at one time, cough medications were being prescribed, and now really often honey is being recommended. So it's important to, think about the conventional care your child is receiving from their pediatrician or other mainstream practitioner or provider, and really think about an integrative approach that's focused on prevention and promoting health under the guidance of that healthcare professional.
Thank you for that. We have time for some questions from our attendees right now, and thank you everyone who has submitted questions. Many of them were very similar. One of them was in follow-up to what you said about melatonin earlier. I think you mentioned 0.5 to 1 milligram to be given 30 minutes before the desired sleep time. Is there an age range for that? How young's too young? Is it the same dose for all ages?
So there is a really good article on melatonin, and have we put that in the chat? So I'd love to direct you to the article on melatonin. It is in healthychildren.org, and it talks about some of the safe uses of melatonin. You may find that your doctor is going to recommend a slightly different dosing of melatonin depending on your child's specific condition. We have used melatonin in very young children in the hospital and have been able to use it absolutely safely. So I recommend with questions like that to really talk to your doctor about what is best specifically for your child.
Another question submitted that I also get a lot as a pediatrician is, what about gripe water for infants with colic, for example? I hear this as a possible natural product to use.
Yeah, gripe water is generally very safe. It often contains things such as chamomile or fennel or anise. These are generally safe in children. They may be antispasmodic for the gut, so it might sort of decrease if there is an abdominal pain or belly pain, component of the colic. But again, pay very close attention to the ingredient list, because some of the formulations may be made with alcohol, or you may be surprised to find that there are some other things in the gripe water that you didn't expect. So as you're looking at these options, be sure to be talking to your pediatrician and to let them know all of the ingredients that are in there to see whether or not this is something that would be safe for your child. Always going with trusted brands, with brands that have good manufacturing processes, are really a safe way to go.
That kind of leads into our next question. During COVID and flu season, I have parents asking about elderberry and echinacea. You mentioned the good manufacturing practices. Is there a role for these in these types of respiratory illnesses, and any cautions about products with possible impurities?
Yeah, well, I will say that more research is needed, and that'll always sort of be my first thing that I'll say about that. But we know that elderberry, for example, has been used medicinally for centuries to fight infections. And there were some studies that show that elderberry extract supplements could shorten the duration of flu when they compared it to placebo, or giving, something that wasn't elderberry but kind of looked exactly the same to the person taking it. Now, there are other studies that have shown that maybe that's not quite the case, but we do know that in general, elderberry tends to be pretty safe. Echinacea is another one that tends to be pretty safe. I will say one caution with echinacea is if you're, allergic to some flowers, you may have an allergy as well. So of course, you always have to, look at your particular response to the things that you're taking. Just because we don't have research that absolutely proves that something 100% works doesn't mean that it's not safe. And it doesn't mean that it's not safe for your child. So involving your pediatrician in those discussions are always really, really, really important. And while more research is needed, there is some evidence that shows that these things may be helpful in viral infections. Oh, you also talked a little bit about impurities. So that's, of course, something that's always very important to think about. Because the FDA recommends supplements as food, they're not doing that third-party testing, or that, they're not looking to see what supplement manufacturers have those good manufacturing processes. So it's really important that you know the brands that you're using and if they have good manufacturing processes themselves. So are they taking a look to make sure that there aren't contaminants along the line as they're making these products that you're thinking of giving to your children?
Thank you for that. We have a follow-up to your discussion about honey.
Yeah.
Are there different types of honey that are better than others? Buckwheat, mucuna, regular honey?
So there are a number of different honey products. I don't know that I will tell you that one product is better than the other. I will say that, there are some honey products like mucuna honey that have actually been looking for treatment with wounds. And so when you're looking at the different products, I think it's great to look at their label and look at the information from their manufacturer to see exactly how they're checking the purity of their product and what studies they may have to show that it's worked for different things.
We have a question about CBD oil and whether that is safe to use and effective for anything in children.
Okay. So there is, so CBD oil, CBD is a supplement, and so it is not regulated as a medication by the FDA. There's one exception to that, and that's Epidiolex. And so Epidiolex actually is a medication, a CBD medication that is generally prescribed by your neurologist for children who have certain types of seizures. So you have to have certain types of seizures in order to qualify for the use of Epidiolex. So putting aside Epidiolex and just looking at CBD oil in general, so in general, it is not regulated as a medication. And so what that means is that there may not be checks to see how pure the CBD oil is and whether or not there's a THC component to it. So that's important because we know that like THC can actually potentially make seizures worse. And so I think the difficulty with getting an over-the-counter sort of CBD oil is it can be really hard to know what else is in there and what sort of amounts of the other things that are in there that you're giving to your child.
Okay, we have a question about belladonna and teething tablets. Is that a product that's still available? Do you recommend it, not recommend it?
The belladonna and teething tablets that you're talking about is likely the homeopathic remedies. And I will say that in general, homeopathic remedies are typically safe unless there was a mistake that was made during the manufacture of it, which is why it's so important to really understand the manufacturing processes of the places that you're getting medications or treatments for your children.
I'm going to go ahead and turn things back over to our AAP staff to wrap things up.
Okay. Thank you so much, Dr. Shu and Dr. Brown. We really appreciate it. We want to remind participants to register on healthychildren.org to receive our newsletter, a personalized homepage, and special offers. And don't forget to follow healthychildren.org on Instagram, Facebook, Pinterest, and Twitter. We hope you enjoyed today's webinar. Keep an eye out for a quick survey. Please let us know what you found most helpful and any suggestions you may have. And a very special thank you to our sponsor, Vicks, makers of children's botanicals. Thanks again for joining us.